Hello everyone, my name is Contreras, and this is my presentation on stem cell therapy, a regenerative tool to repair tissues and improve systems functionality. So my query question is describe what stem cells are and the ways they are classified. Compare and contrast the classifications of stem cells and why stem cells' functions would make them useful in the medical procedures. Be able to describe why stem cells are being researched for medical treatment and understand the advantages and challenges with stem cell therapy. The student learning objectives. At the end of this presentation, students will be able to describe what stem cells are, compare and contrast the different classifications of stem cells, and summarize the advantages and limitations of stem cell therapy. So what are stem cells? Stem cells are types of cells that have a unique ability to self-renew and differentiate into more than one cell lineage. Their unique properties include self-renewal, which means they can divide and produce identical copies, their pluripotency and multipotency as well. And the figure on the right is just showing how stem cells can differentiate into multiple types of cells. So what are the functions of stem cells? So their self-renewal function is the ability to divide and produce identical copies of themselves indefinitely. This maintains a stable pool of stem cells for future generations. Differentiation or specialization is where they become specialized cells. For example, a cell will become a muscle cell or a neuron. Then you have their tissue repair and regeneration. Stem cells differentiate to replace dead or damaged cells, wound healing. They also participate in paracrine signaling, which release growth factors that stimulate local cell repair. Their immune modulation, they suppress harmful immune reactions. The homeostasis is where they replace worn-out cells. The disease modeling, stem cells, especially induced pluripotent stem cells, are grown into diseased tissues in labs. They're used to study how diseases develop, especially in Alzheimer's and diabetes. They're also used to test new drugs safely before going to human trials. And stem cells also have a potential for bioengineering, so growing lab-made organs for transplants using 3D bioprinting and stem cells or patient-specific induced pluripotent stem cells to avoid rejection. So the differentiation, they can be totipotent, which means the stem cells can give rise to any cell of the embryo, but also give rise to embryonic tissue. They can also be pluripotent, which means the stem cells are limited to any of the 3 germ cell layers. Multipotent stem cells can differentiate into the 1 germline tissue. Oligopotent/unipotent stem cells are seen in adult organ tissues that have committed to 1 cell lineage. So the type of stem cells by their origins, you have embryonic stem cells. These are derived from early stage embryos and they're pluripotent. The adult somatic stem cells are found in tissues like bone marrow and skin. These are multipotent stem cells. Induced pluripotent stem cells, these are reprogrammed adult cells to act as embryonic stem cells. And then we also have mesenchymal stem cells. These are found in bone marrow, fat, and umbilical cord, and these are used in regenerative medicine. So stem cells' origin in medicine, it has a long history, but what's most kind of accredited for putting stem cell therapy on the map is the first bone marrow transplant that happened in 1956. It was first performed by Dr. E. Donald Thomas on a child with leukemia, and it shed light on potential stem cell therapies for the future. So what can stem cell therapies do? They can treat genetic blood diseases. They can treat pain states and neurodegenerative diseases like Parkinson's and Alzheimer's. And it also offers hope in the setting of neurodegeneration. We may be able to potentially replace neurons damaged by the pathogenesis of certain diseases, like in Alzheimer's or Parkinson's. Okay, so the treatment of genetic blood disease. This is one of the most prolific uses for stem cells currently. Um, this is used because of the genetic defects that prevent proper functioning of the cells derived from the hematopoietic stem cell lineage. Hematopoietic stem cell therapy replaces patient defective blood, forming stem cells with healthy stem cells, and this can be done via bone marrow transplant. And the figure on the left, again, is just showing you how stem cells can differentiate into multiple kinds of cells. And the figure on the left is especially showing the type of blood cells that stem cells will differentiate into. So the blood stem cell therapy process. So the patient undergoes chemotherapy and radiation, which destroys diseased bone marrow. Then healthy donor cells are infused into the patient. The new stem cells repopulate the bone marrow, and this can potentially treat sickle cell disease, thalassemia, leukemias, and lymphomas. In the treatment of sickle cell, they want to replace the defective red blood cells with healthy blood cells. In thalassemia, a successful transplant eliminates the need for lifelong blood transfusions. In leukemia, it can replace cancerous blood cells. And then the advantages of stem cell therapy over traditional medical treatment. So stem cell therapy is minimally invasive. It's not. There's no really stem cell therapy right now where you have to undergo like a large surgery or anything like that, especially for more like, I guess, elective treatments. If it's just treating like a tendonitis or treating a wound that is not too severe, it is minimally invasive compared to other treatments that are available to you. It can also reduce chronic pain and inflammation. And one of the biggest advantages stem cell therapy has is its potential to cure diseases and not just manage. It's not just manage the disease. You can try to cure the disease instead of just treating the symptoms that are being caused by the disease. And another one of the largest advantages is the personalized medicine aspect. If in the future we're able to produce bioengineered organs, there's no way a person's body would reject an organ made by a stem cells from the same person. So it could really just expand the field of organ transplants and kind of make procedures like that a little bit more accessible. And then we have the limitations of stem cell therapy. So stem cell therapies do have a great promise for treating diseases like Parkinson's, spinal cord injuries, and diabetes. But despite the potential, there are significant scientific, ethical, and regulatory challenges. So first I'll start with the challenges. So there's the risk of tumor formation. This is one of the biggest risks with stem cell therapies, particularly with pluripotent stem cells, like the embryonic stem cells, which can turn into the most kinds of cells. So yeah, because they can turn into as many cells as possible, there's a highest chance of that those embryonic stem cells or those pluripotent stem cells becoming cancers or teratomas. And then we also have the risk of immune rejection. Even though some stem cells, like the mesenchymal stem cells, have immune privilege properties, others can still trigger the immune rejection. And especially if they're coming from donors or from patient-matched induced pluripotent stem cells, which reduce the risk, but there is still that risk of the immune rejection. Without proper immune compatibility, patients may require lifelong immunosuppression, increasing the risk of infections and complications. And we have the high cost and the limited availability. Stem cell therapies are extremely expensive due to the complex manufacturing, their quality control, and the lengthy clinical trials that they have to go through to even approve a therapy like a stem cell therapy. And scaling up the production is very challenging. So it's just been a struggle to make these treatments more accessible to patients. And then for the ethical issues, we have the use of embryonic stem cells. The use of embryonic stem cells is really controversial because extracting them involves the destruction of human embryos, and this raises ethical concerns about the moral status of the embryo, whether it constitutes a human life, and many religious and pro-life groups are trying to put more restrictions on the use of embryonic stem cells. And then we have the regulatory hurdles. It's very tough. It's just a strict regulatory oversight. Stem cell therapies always face hurdles, especially from the FDA and the EMA, which require extensive preclinical and clinical testing. And the lengthy approval process really slows down the development of stem cell therapy. And there's also a lot of unproven clinic and misinformation, especially online, especially on social media. And then for your self-evaluation, I would like to ask, what is a stem cell? What is the self-renewal and differentiation of stem cells? That's kind of like on the one of the earlier slides with the functions of stem cells. And then what is an advantage of stem cell therapy, especially compared to, modern treatments. And these are my references. Thank you.